Stop! Are you making these deadly mistakes with your ADHD meds? You might think you're in control, but one slip up could land you in the ER or make your ADHD even worse. Stick around because number 7 is a jaw dropper even doctors don't warn you about. Let's dive in, and trust me, you don't want to miss this. ADHD medications can be life-changing, but only when used correctly. The problem? Most people are making serious, avoidable mistakes that are sabotaging their focus, their health, even their future. Today, we're breaking down 10 dangerous ADHD medication mistakes backed by science. And yes, you'll want to hear every single one. Mistake number 1. Playing mad scientist and jacking up your dose without your doctor's approval. You're feeling unfocused, thinking, a little more Adderall will make me unstoppable. But the Lancet warns that too much stimulant can fry your brain, causing hallucinations, paranoia, and even full-blown psychosis. Picture this. You see shadows moving in your room. You hear voices whispering your name. That's not ADHD. That's your overdose talking. Take Jake, a college kid who doubled his dose for finals. He ended up in the ER, drenched in sweat, convinced his roommate was a CIA agent spying on him. Doctors set limits for a reason. Overdo it, and your heart might race straight into a panic mode, or worse. Mistake number 2. Turning ADHD meds into a party trick. Huge mistake. Snorting Ritalin, chugging Vyvanse, or using Adderall for all-nighters isn't just risky. It's a one-way ticket to addiction. The New England Journal of Medicine found that 58% of college students misuse ADHD meds, thinking they'll gain a superhuman focus. The reality? It's a dependency trap that rewires your brain. Cravings increase, crashes hit harder, and before you know it, you're stuck. Mistake number 3. Mixing stimulants with alcohol or drugs. That's playing Russian roulette with your body. BMC Psychiatry reports that combining ADHD meds with substances like MDMA or alcohol can spike your blood pressure to dangerous levels. Hello, Blackout City. Take Tony. He thought he was fine mixing Adderall with shots, until he woke up in an ambulance, his heart slamming against his ribs. Don't be Tony. Keep it clean. Mistake number 4. Ignoring dangerous food interactions. Did you know that what you eat and drink can make your ADHD meds useless? Studies show that orange juice, coffee, and high-fat meals can either block or slow down stimulant absorption. Take Emily. She downed orange juice right before her Adderall, and it barely worked. So she accidentally doubled her dose. Hours later, she was sweating, shaking, and regretting everything. How to fix it? Eat the right foods and your medication will work better, safer, and longer. Mistake number 5. Ignoring your body's warning signals. Bad idea. No sleep for days? Appetite gone? Heart pounding out of your chest? That's your body screaming for help. European Child and Adolescent Psychiatry found that these side effects can stack up fast, even causing stunted growth in kids. Lisa's son was struggling. Every night, he took forever to sleep. She thought he'd adjust, but instead, his doctor had to yank him off the meds completely. Don't be a hero. Tell your doctor before red flags turn into a full-blown emergency. Mistake number 6. Thinking pills fix everything. ADHD meds help, but they won't organize your desk, mend your relationships, or fix your deadlines. The New England Journal of Medicine found that stimulants can boost focus, but don't teach life skills. Sarah was killing it at work on Adderall, aced every project, but guess what? She still lost her job because her inbox was a dumpster fire. Meds are your booster rocket, but you still need therapy, structure, and real-world coping strategies. Because focus without strategy just means you're speeding toward failure. Mistake number 7. Forgetting your heart's in the game. Your brain isn't the only thing ADHD meds rev up. Your heart's in the game too. Studies in PMC found that stimulants users have a higher risk of heart problems like arrhythmias and hypertension. Nate ignored the chest tightness he felt on Vyvanse. He went for his morning 5K run, pushed through the pain, and collapsed cold on the track. Docs say you need regular heart screenings if you're on ADHD meds because your heart isn't invincible. It's the one thing you really can't afford to ignore. Mistake number 8. Turning ADHD meds into study crack. No diagnosis, no prescription, just desperation. 58% of college students admit to using ADHD meds just to grind through finals. The New England Journal of Medicine says, if you don't have ADHD, these pills won't help you focus better. Chris was one of those students. He stole his roommate's Ritalin, pulled an all-nighter, and guess what? He blanked on the test anyway, and then he couldn't stop. ADHD meds aren't cheat codes. Misuse them, and the only person getting played is you. Want better focus? Fix your habits, not your prescription. Sleep, structure, and strategy will always outperform popping a pill you don't need. Mistake number 9. Underestimating withdrawal and dependency risks. Most people think ADHD meds are just a simple on and off switch. But here's the truth. Your brain gets used to them, and stopping suddenly, that's like slamming the brakes on a speeding car. Ever feel like your motivation is gone the moment your meds wear off? Or like your ADHD symptoms are suddenly 10 times worse than before? That's withdrawal and dependency creeping in. A study in JAMA Psychiatry found that stopping stimulant meds suddenly can trigger depression, extreme fatigue, and even suicidal thoughts. This happened to Jake. He had been taking Adderall for 2 years. One day, he ran out of pills and thought he'd be fine. Instead, he spent the next week in bed, unable to function. His brain had relied on the medication too much, and going cold turkey sent him into a mental fog that lasted for weeks. How to fix it? Never stop ADHD meds suddenly. Always taper off with your doctor's help. Track your mood and energy levels when making dosage changes. Pair meds with behavioral strategies so you don't become fully dependent. Think of ADHD meds like a double-edged sword. Wield them carelessly and you'll cut yourself deep. Mistake number 10. ADHD meds can worsen anxiety if used wrong. Think ADHD meds are always calming? Think again. For some people, stimulants don't just block focus, they also jack up anxiety, making you feel restless, paranoid, or like your heart's racing out of control. A study in the New England Journal of Medicine found that up to 30% of ADHD patients experience worsened anxiety on stimulant medications. Mia started with me, hoping for better focus. Instead, she felt wired and anxious all the time. Her heart was pounding, and every small problem felt like the end of the world. How to fix it? Talk to your doctor about non-stimulant options like Strattera or guanfacine. Lower your dose if you feel constantly on edge. Avoid caffeine and stress triggers. Stimulants plus anxiety? Bad combo. Anxiety is not just part of the package. If your ADHD meds are making you feel worse, not better, it's time for a change. These 10 mistakes can wreck your ADHD treatment or even land you in the ER. Now you know how to avoid them. If you found this helpful, hit like, smash that subscribe button, and tell me in the comments which mistake shocked you the most.